Before Worldlink, I almost felt like my job was to know pharmacology well, and my job was to identify and diagnose. And if I could identify something and diagnose it, then there was a pill for that, or there was a cream, or there was a treatment, or there was something that you could use to sort of fix it. But you look back on it and you realize that you weren't really fixing anything, you were putting a Band-Aid on it.
You're seeing 25 to 30 patients a day, and then you go home and you're charting until 10 or 11 o'clock at nighttime, and you're really not making a difference in their life. You see them back 6 months later or a year and nothing's changed.
At 46% body fat and 323 pounds, he was really headed in the wrong direction quite quickly. Through implementing tools that I've learned at Worldlink over the years, and optimization of hormones and lifestyle change and supplements and patient education, I was able to dramatically change his body composition. So he went from 46% body fat to 15%, and I have that mapped out on our body composition machine, so it's very objective. I'm just not making this up.
I have one patient that he's off all his insulin, and he was on 2 oral glycemic medicines. Now he's just down to 1. So depending on the duration, maybe we can't get you off all of certain medicines, but I have many patients that have been able to reduce or completely eliminate their other medicines completely.
I would never go back to that conventional, I call it the sickness model. It is a sickness model, and the changes I've seen in my patients doing what I call the wellness model, it's changed my own life. And I love practicing. I'm absolutely passionate about it. In fact, I'm approaching companies to say, give me now your diabetic patients, type 2 patients. We can reverse that, and that's going to change the bottom line of not only their health, but your bottom line of your financial situation at your company.